Hi, I'm Dr. Soumya, obstetrician and gynecologist and laparoscopic surgeon at Cloudnine Hospitals, Hyderabad. Is traveling safe in pregnancy? Most women come up asking, Ma'am, can I travel in pregnancy? Yes, it's safe to travel in pregnancy, but do consult your doctor before traveling. When is it safe to travel in pregnancy? The second trimester is the ideal period to travel in pregnancy. It starts from 13 weeks till 32 weeks. Beyond 32 weeks, you have to consult your airlines before you actually plan for any travel. What are the best modes to travel in pregnancy? Is it flight, car, or the train? The train would be the safest mode to travel in pregnancy. That's because it's just like a room and you can walk and you can hydrate and you can get down as well, as your activity levels are not restricted. The second is a flight. So when you travel through flight, let your airport authority know that you're pregnant so the metal detectors are avoided. As well, when you're traveling in the flight, make sure that you wear the seat belt and that comes exactly below your belly. Try to do leg stretching and the muscle stretching at least every 30 minutes and walk around when it is safe to walk in the flight. Hydrate yourself frequently and if possible, wear the stockings which will avoid development of the deep vein thrombosis. That means the clots in your legs. The next question is, can I drive in pregnancy? Yes, you can actually drive if you're perfect and if you're a safe driver. So make sure that again your seat belt, that's the shoulder belt, comes in between the breast and the lower belt comes below your belly. If you're traveling more than 4 hours, make sure to have a breaks in between at least every hourly or just stretch your legs as well. What are the contraindications? When does your doctor actually restrict you from traveling in pregnancy? If you have previous history of miscarriages or you have any episode of bleeding recently or there is any cervical stage, any low-lying placenta or any previous history of deep vein thrombosis, that means the clots in your legs, or you are having a hypertension in pregnancy or preclampsia in pregnancy, that's where your doctor will warn you not to travel in pregnancy. What are the precautions to be taken? As I told you before, make sure that you hydrate yourself properly. Whenever you're having food outside, make sure it is warm enough to take and please avoid the raw meat or any raw vegetables also if you're eating from the outside. And make sure to stretch your legs and foot frequently. Whenever possible, just have a walk for 5 minutes and relax yourself. And please do not forget to observe your baby movements whenever you're traveling. And if any emergency, like if you see any bleeding or abdominal pain or abdominal cramps or any leaking, the watery discharge from your vagina, if you see any of the above symptoms, don't forget to seek immediate medical help.